Health clinic is all about matters of health, how to worry about your health, what are certain diseases you're going through, and you need health experts, and we bring you live here in studio. As always, I'm your host of show, Brenda, bringing you this show, Health Clinic. You can go on your Facebook page, on YouTube, and also on Instagram. You just type in youth, you'll get us live here in exactly 11 a.m. On Friday, we bring you Health Clinic, where we bring health experts who tell you what could be the cause of your problem that you're suffering from. And here in studio, don't forget, Health Clinic is proudly sponsored by, or is brought to you by, the Fundamental Rights and Protection. We say rights matter to you. And today in studio, I am also still joined in by our doctor in studio. He's coming in from Mulago. He's going to be introducing himself, and we welcome you on our show today.
Thank you, Brenda. Thank you, our viewers, and those who are live, and those who are watching us from Facebook and YouTube. This is Dr. Mario Nicholas, and today we are going to talk about heart diseases. Yesterday we talked about heart diseases, but we are in Uganda. So today this is the English version.
Yeah.
Yes.
Yeah, Dr. Malay is back in our studios today to still talk about heart disease. And yeah, we talked about it yesterday still, but we are using the other language that you may not all understand. That's why we brought you this show on Friday. That streams still the same time, 11 a.m. And the other program, the one in the other local language in Uganda, is still hosted. Is from Monday up to Thursday. It's still, the time is still the same, just 11 a.m. And we bring you what we did. There are those people who are complaining that, hey, we don't understand the Luganda. We said, okay, what we can do, we can always stream live again on Friday and bring you the show in English, because we would want you to understand. And when it comes to matters of health, it doesn't matter who you are, it doesn't matter wherever you are, but as long as we still have to use the language that we can all understand. And today in studio, that's why we are back again with our doctor in studio to talk about still the matters of health. And before I even continue, I would like to remind you all parents, we all know our children are back to school, and when we go back on Monday, where our president led us. But I would just like to remind you parents out there, please, for all, if you're still looking for school, here on Youth Academy, there is an intake going in. We are enrolling students who also want to know about journalism. You want to know maybe about all about photography, video editing, and many more. And even maybe you are inspired by what I'm doing, you can always do this. So just come in, they train you on a fair amount of money, so you don't need to worry about that, but we can still continue. That marks, we just go into our show of that day. Yeah, our Dr. Malay told you yesterday, talked about heart diseases, and we are back again with heart diseases. And because we all know the matters of the heart, it's like the engine of the whole body. So you cannot go on unless the engine of the whole body is taken into and we drive in what could be the problem. Because yesterday, as we told you, that the heart diseases are increasing day by day. The percentage, our doctor said by 2030,
Yes.
by 2030, it's marked that the country or the whole world at large is going to be rid. The diseases that are going to be all over, it's these non-communicable diseases. The diseases that just are within that, they don't contract if in case you get nearby somebody. No, that those diseases that are transmitted, they are not even transmitted, I would say. So we are back again. We tell you what could be the cause of that disease. We tell you the effect, the symptoms, what could be some of the precautions you take before even it comes on board. So our doctor would, as we continue or as we begin the show, what are heart diseases?
Heart diseases, these are diseases which mainly affects the heart.
Okay.
Yes, and sometimes also the blood vessels.
Yes.
So we group them into a collective term known as cardiovascular diseases.
Okay.
Yes. Cardio meaning the heart, vascular meaning the blood vessels.
Okay.
Yes.
Okay, so that is how it is termed.
Yes.
And are there categories of heart diseases, or it's
Yes.
generally one?
We have those on which are congenital heart disease, and we have those on which are acquired heart disease. Congenital heart disease, these are the diseases which we are born when we have them.
Okay.
Like actually we detect them before, after birth, However, some of these can also be detected later in adult life. Yes. And majority of these include, we have the atrial septal defect, we have the ventricular septal defects, and so many. For the acquired, we have so many.
For the acquired?
Yes, acquired heart disease, we have so many. We are going to look at them. We have the valvular heart disease, those diseases which affect the valves. We have the cardiomyopathies, disease which affects the cardiac muscle. We have a hypertensive heart disease. We have a coronary artery disease. We have a ischemic heart disease. There are so many.
All these are so many.
All these affects the heart.
Anyway, we shall be touching one by one slowly as the time leads on. But still, our viewers out there would like to know, what are some of these symptoms that in case I spot out a symptom, I'm able to detect that now I'm suffering from already a heart disease?
What I want to our viewers to know that heart disease or heart-related diseases nowadays are the leading cause of death globally.
The leading cause of death.
Yes,
wow,
globally, and it is estimated that by 2030, it will be the leading now. It will be now the major cause of death. It's
already leading, but now 2030, it will be the major cause of death. Wow, yes. That is a point for us to note.
And it is under non-communicable diseases. Okay. We talked about the non-communicable diseases. These are diseases which are not easily, which are not transmitted from one person to another. They include diseases like heart disease, kidney disease. We have liver, we have diabetes, and so many.
Many and many.
Yes.
So all those are the
non-communicable diseases.
Non-communicable diseases. Yes. Okay, but now
so they are increasing because nowadays you hear people are dying of cancer. Our first session was about cervical cancer.
Yes, cervical cancer.
Yes, now this is our second session. So we shall be doing these sessions.
Yeah, we shall be doing this session, but our viewers, I would like to remind you, in case you have any question, just go into the comment section and you text us. We shall always ask the doctor if he's in studio. We just ask him and he'll respond there and then. And in case maybe you missed the show, you just have to go back on our channel, YouTube channel, or maybe Facebook on our channel. You just type in Youth Media, you always catch up and follow up on the previous shows that you missed. Don't forget that Youth Media, you can find various shows. It's not only Health Link that is happening here, but also various shows that are taking place. Our doctor in studio today is talking about heart diseases, and he has told you that come 2030, heart diseases are going to be the major cause, I would say the ruling cause of death in the world at large. Not only Uganda, but a world at large. That requires an action to take. And it talks you, please just stay tuned, watch us live wherever you are. All you have to do is load your data at full. We are here bringing you the show. So Doctor, you're still telling us some of the symptoms when somebody notices any symptom that they should run to the hospital. What are some of these symptoms?
Yes, these symptoms which I'm going to talk about, for them they are strict to the heart, and when you have them, just know that you just have to go to the hospital for.
You just have to rush
to the because they are so important. And when you have them, don't waste time.
Okay.
Yeah, it's not witchcraft, which I'm going to talk about. Don't waste time.
Witchcraft, juju, all that.
Go to the hospital. Don't even call a friend that you know what, can you direct me to a medication? What? No. Go to the hospital.
Can I take a painkiller?
Yes. No, you don't have to take painkiller. Just go to the hospital.
You just have to rush for your life.
People here have a tendency of
self-medication.
Self-medication sometimes it's good because maybe having a headache and take painkiller and you get relieved. It can help. Okay. But there are some conditions whereby when you self-medicate, then you are complicating the problem.
Okay.
Yes.
So you just keep on complicating. That's why it's not good to medicate, because at times you may think it's minor, not knowing it's something severe that you need to take course of action. So what could be some of the symptoms?
The first symptom which I'm going to talk about is chest pain.
Chest pain.
Chest pain. When I have feeling chest pain.
Okay.
It can be around here, substernal chest pain. Patients normally describe this pain as they feel as if the chest is heavy. They feel chest heaviness, and sometimes this pain can radiate on the left side.
Okay.
It can radiate left jaw and the left arm.
Okay.
Yes, it's a pain which is whereby you feel as if there's something sitting in your chest. Yes.
You feel heavy loaded
there's
within the
heaviness
chest.
in the chest.
Okay.
The chest is tight. You cannot breathe well. So that symptom is a really very dangerous symptom. Don't wait. Don't take a painkiller. Just rush directly to the what?
To the hospital.
To the hospital, yes. Another symptom is difficult in breathing. Sometimes we call it shortness of breath.
Okay.
So you are having air hunger. You don't breathe. You take those shallow breaths, like you cannot breathe very well. So that symptom also signifies that there's a problem which is going on within your lungs. And whenever the heart is failing, the blood tries to collect within the lungs. So because the heart is supposed to pull blood from the lungs, so when the heart fails, there's a backup flow of blood into the lungs. So this will cause difficulty in breathing. Yes. Another symptom is swelling of the body.
Okay.
You can swell the limbs, you can swell the abdomen, can swell. So when you notice that symptom, please don't go to what? Don't self-medicate. Just go directly to the what? To the hospital. So that swelling, actually, when you press on the, like, especially if you swell on the limbs, and you press, and you feel there's a pitting, there's a hole which comes of the finger which you have used. That's what is that symptom. We call it it's a sign. We call it a pitting edema.
Because normally when you touch or you press
yes,
it comes back automatically. It doesn't create a hole. Yeah.
So that one shows that there is a lot of fluids within the what? The cell, within the interstitium of the cells. It means that the heart is failing. The heart cannot pull blood from these parts. So fluids try to remain within the what? The spaces within the cells. So that symptom is a dangerous symptom. Yes. Another symptom is easy fatigability. Easy fatigability means like you easily get tired. You walk like from here 10 steps, you are tired, you feel tired. If it is a child, he or she cannot play. If it's a breastfeeding infant, they normally sweat when you are breastfeeding them. They sweat. They have just started breastfeeding and they are sweating. Yes, those symptoms are really very dangerous. Yes, easy fatigability, chest pain. Another symptom is orthopnea. Orthopnea is difficulty in breathing when you are lying flat, when there is no pillow. So when you are experiencing that difficulty in breathing while lying flat, it means that there are fluids within your lungs, and you cannot breathe when you are lying flat. So you can only breathe when you are leaning on on pillows, or when you are lying on very many pillows. Yes. Another symptom is paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea is difficult in breathing, like you wake up at night gasping for air. The dangerous one signifies that there is what? Heart failure. So those are the symptoms of heart failure.
So basically those are the symptoms. Yes. And when you talk about them, some of them, all these are able to be noticed. You know that those symptoms that it's hard for you to notice, but there are those symptoms, as the doctor say, it's easy for you to notice. It's now, for example, if you wake up on the night and you you will never forget that experience. Trust me. And also now when you say when all your left body is all in pain, that means
not all the left body, but just the left side, left jaw, and the shoulder and the arm
only.
Yes. Yes, not the leg and not the abdomen. So just the jaw, neck here, the shoulder and the arm. Yes.
All those are signs of a heart disease that you should rush. Now you talked about that these diseases don't only attack children, but now who are these people who are at risk? What are the risk factors?
So we have so many risk factors. The first risk factor which I'm going to talk about is a sedentary lifestyle. Sedentary lifestyle means it's a lifestyle whereby there's no physical activity.
No physical activity.
People, yes, with this lifestyle, people have money. They have cars. Someone get from bed, goes to work in the car, eats, comes back in the car. So there's no time for exercising. You don't walk. So this lifestyle is really dangerous. Yes, you are eating fats. You are not exercising. The body is not burning those fats. So these fats at the end, they accumulate within the blood vessels, and then they block the blood vessels. Yes, have you ever heard of that someone is having a blood clot.
Yeah, we
So he's died of a blood clot.
We hear those so
People
often.
have died of blood clot.
Yeah.
So a
and
blood
it's because of that.
Yes. A blood clot occurs when your blood vessels, like especially the blood vessels which supply the heart and the blood vessels which supply the brain.
Okay.
So have you heard about stroke?
Yeah, I heard about stroke.
So when you get when you have a lot of fats within your body, these fats, they accumulate within the blood vessels and they narrow the blood vessels. So when they narrow at the end, these rupture. When they rupture, the blood will try to clot with inside.
Okay.
So when the blood clots, it prevents blood from supplying that area which was supplied by what? By that vessel, leading to that area to undergo ischemia and infection. So that's basically meaning the death of the organ. Yes. If it occurs in the brain, that's a stroke.
That is definitely a stroke.
If it occurs in the heart, you hear people that someone is having a heart attack.
A heart attack.
Yes.
Well, that is definitely, as the doctor, he is still with us here in studio. We're going just into a short commercial break, but coming back, our doctor is still telling us what could be some of those things, who are the people who are at risk to get these heart diseases. And also, coming up, don't forget, you are going to see him explaining also what could be the causes of heart diseases. Just stay tuned, don't go anywhere, we are coming back.
Anywhere.
Yes, my name is Semakula Ian and I do graphics. I'm a graphics designer, straight out Ian King Graphics. Yes, in my free time, I don't need decoders, I don't need antennas, subscription, monthly subscription. I tune to UTIS Media. Just go on your phone, you only need data and a phone which accesses the internet. That's all, and you tune to UTIS Media anywhere, everywhere you go. Yes, thanks to UTIS Media for this pleasure that anywhere we are, we can tune to the TV and view. Thank you.
Njeko basewo ne banyawo amanya gange itiba mugisha gansimije nga ndi muyizo okuba ekitangala high school. Ndi wano okubategeeza nti nze nandyagadde okubeera modo oba kazanyiriza oba actor ajjudde. Era ndi wano okubategeeza nti olwa corona twagiddwa ebintu bingi, tubumbiddwa ebintu bingi nga for example TV wakali bwe tuli abaana bangi ffenna tugikozesa tetusobola laba kye twagala at the same time. Kati for example nze ndabya abamodo baganda bange bagala kyawe kati sawo tubeera tugera kulwanira TV. Kyeneebaza kyenjaba bagamba nti olwa UTIS Media omutimbagano omupya batukoleddeyo UTIS Media tukoleddeyo website yaffe empya wetusobola okujjawo ekimu kye twetaaga. So nandyagadde baganda bange abalala kati nga nze ngenda nengoyera ku yamodo benjagala n'ebirala ebintu bye nandyagadde okulaba. Era namwe mbakubiriza mugende namwe mugende mu UTIS Media musobole okulaba kye mwagala ate ekisinga nabo ya ku masimu gammwe ku laptop byonna gadgeti ze mulina.
Still on here on Health Clinic, bringing you what are some of the health tips that you don't need to miss, especially today when you're talking about the heart disease. And our doctor told us that come 2020, heart disease, it's reported that heart disease are going to be the ruling or the top world ruling cause of death all over the world. So in all that, you need to stick around and follow the show. For those who missed the first session, sorry for everybody can always play back and also see some of those previous. And there are those who wonder that when does this show happen? This show takes place on Fridays Health Clinic happens on Fridays at exactly 11 a.m. We're just here in the studio with our doctor or health experts telling us some of the health tips that you don't need to miss. And today, don't forget, here on Health Clinic, you can find us on Youth Media, on Facebook, Instagram, Twitter, YouTube. You don't forget to subscribe also, because when you subscribe, whenever I go live, you get a notification bell. You get a notification message that we are live. It can be Health Clinic or any other show, because we have various shows. And before we went into a break, the doctor was telling us some of the causes, all the risk factors. In the first session, he told us some of the symptoms you could see, some of the people who are at risk of this heart disease, and he told us, especially for those who don't do exercise, you just eat full of fats, you eat a diet full of fats, and you don't exercise. That is it can be also a risk factor for you.
Yes.
So you can continue with the risk factors.
Other risk factors, we have obesity.
Obesity.
People who are obese, I mean, these are people who are having a body mass index above 30. Yesterday we talked about body mass index, and the normal body mass index is supposed to range between 18.5 up to 24.9. 18.5
up to 20.
24.9. So if you're above that, and you're above 30, you are obese.
You're obese.
Yes. You're overweight.
You're overweight, or can you be underweight?
Yes. If you are below 18, you can be underweight.
Underweight.
Yes. So it's better to be in the normal range. Okay. Yes. If you are in the normal BMI, your risk of getting heart diseases is really very, very low. Okay. Yes.
So that is also one of the risk factors.
Obesity is a risk factor.
Obesity.
Yes. People who are obese, I don't know what you have to do, but you have to make sure.
How can they how can they balance it now? Because
they have to lose weight.
You have to lose weight.
If you are obese, you go to the hospital and maybe tell the health workers to help you to get your BMI, to calculate your BMI. Because BMI is a ratio you get. Your kilograms, your kg divided by your height in meters squared. If you fall within the normal BMI, you're okay, normal range. But you are above that, you have to lose weight.
You have to lose weight.
Lose weight, because if you're obese and you are aging when you're obese, your risk of dying of a heart disease risk is high.
What of this other party? For them, they are not overweight, but maybe they are low. The obesity is low. They're not at the normal rate where you say it.
For those who are underweight.
Underweight, yeah.
For underweight, they have other issues. Maybe concerning, they have other issues. For them, the heart disease not normally affect them.
Okay.
Yes, but the risk factor here is the obesity.
Obesity. Okay.
People who are overweight, please make sure you go and measure, take your weight and the height.
And yesterday you were telling us how, in case even you yourself, you can measure it.
Yes, I know. You need someone to help you. Okay. You need some measurement, some measurement machines to help you. Okay. Like for the height and the weight. The weight you can take. I normally see people on the street
taking weight.
Yes, that's good. Even height, there are also people take height. There's that thing which is long one. They can be helped. Can be used to take height. Okay. So people who are obese, make sure you lose weight. There are so many things you can do to lose weight. One of them is diet. Control your diet. What you eat, what you take in, is really what is causing you to become obese. So control your diet. Don't overeat fats.
Don't overeat fats.
Yes, don't overeat. There are some good fats. We are talking about the good fats and the bad fats. So don't overeat fats.
Don't overeat fats. That's what the doctor.
So lose weight, exercise. That's the only way you can lose. Another way is exercising. Okay. Yes. So another risk factor is the family history.
Family history.
Family history of maybe of a heart disease. You're having a relative who died of a heart disease. Okay. Yes. You're having your mother with hypertension. You can't escape.
There is no escape route.
If you're having a family history, it means that your risk also of getting of dying of that similar illness is also high. So unless maybe if you put a lot of things into consideration,
okay.
Yes,
they should take precautions, very critical, and not be like their family members as it's in the genes.
Another risk factor is age. Yes, as you continue aging, so these heart diseases, were like attracting the heart diseases, because now God created us with with one heart, and as we age, it also ages.
Okay.
So as we age, time reaches and starts also failing. Yes. So age is also a risk factor for heart diseases. We hear about people who die suddenly, that someone wasn't okay,
Yeah,
and all of a sudden he has died.
And you know what they tell you? That those people, you are like, you were with them yesterday, you're okay. Waking up in the morning, they are dead.
Yes. The problem is the only system which usually cause sudden death is really the heart.
It's the heart.
Because you can be with a heart disease and you don't know. You can be with hypertension, with high blood pressure, and you don't know.
And you don't know.
Because sometimes it is asymptomatic.
Okay.
Yes, and you can get complications all of a sudden, and then you die.
You die out of the blue.
Yes. So that's why we emphasize people to go to hospitals, to see doctors. Everyone is supposed to have a doctor as a friend.
To do regular checkup, in other words.
Yes, regular checkups. Yes, regular checkups are also good, but people with the symptom which I've talked about. And they should go to the hospital immediately.
Immediately.
You're having difficulty in breathing. Why should you go to a pastor to pray for you? Because you're having a heart disease. Go to the hospital first.
But you know there is that. There are those who tell you we went to the hospital. They checked each and everything. They said it's normal. There is also that side.
Yes, but it depends. Sometimes you cannot check each and everything.
Oh.
Just that we have done what we think we could. Yeah. But the human body, you cannot check. You cannot do a whole medical checkup on a human body. There are so many tests.
Okay.
Yes. Another risk factor is a male gender.
Male gender.
Being a male is also a risk factor.
Being a male.
Yes, it's also a risk factor. I don't know.
So being a male is like a disadvantage for you.
Yes, okay. Yes. Another risk factor is the race. African Americans, like blacks, we are prone to heart disease, like hypertension.
The blacks.
The blacks, yes. Actually, if you go to America, the people who are having hypertension are the African Americans.
Okay.
So being also male is a risk factor. Another risk factor is diabetes mellitus. Having diabetes means basically that your blood sugars are not controlled within normal range, and they are high. Okay. So when they are high, they damages the blood vessels. So having diabetes, if you know that if you have a friend who is having diabetes, please just alert him or her, tell him to go to subscribe and join us, so that he can hear what the effects of diabetes.
Yeah,
diabetes damages the blood vessels. Actually, people with diabetes, they die of heart complications.
They die of heart complications?
Yes, because their blood vessels are damaged by these really high blood sugars.
Okay.
Yes. Another risk factor is having a lot of fat, a lot of lipids within your blood. Lipids, I mean the fats, maybe the cholesterol, the bad cholesterol. When you eat a fatty meal, you get those cholesterol, those fats, they saturate within your blood vessels. So this will cause it will cause what you call atherosclerosis. Atherosclerosis is the build-up of these fats within the blood vessels, causing them to narrow. So when they narrow, your heart will have to work an extra mile so that it can pump this blood out of the what? The function of the heart is to pump blood and supply the whole body. However, when the way where blood is supposed to pump, when the way is blocked, by atherosclerosis, the heart is supposed to work very hard. At the end of the day, this heart will fail.
It will fail.
So it will go. You will go into what you call heart failure. You hear about someone is having heart failure. Heart failure. Yes.
And all that you care about somebody having heart failure, somebody you are with somebody yesterday normally, and out of the, even not even yesterday, you can be like just after, I would say, a minute, they step out and they're like, hey, they bring the sad news that they're dead. But what could be the cause of that? The doctor is explaining, and that's why he's saying heart disease could be the cause. And he told you some of the symptoms that you could notice before even you feel the victim of a heart disease. And the doctor was telling us the risk factors that you can also look out. All these people who are at a risk to get the heart disease. Now, our doctor, How do you even check this heart disease if they come to you?
Before maybe go to how do we check? There's 2 risk factors which I forgot.
Okay.
But I remembered. Stress. Stress is a risk factor for heart disease. People with stress, I don't know, but I'm telling you, you should find a way how you are going to manage your stress. Because if you don't manage your stress, stress will predispose you to develop heart diseases like hypertension. Because all of the time when you are in stress, your body will produce a lot of these what we call adrenaline, these hormones which will increase your blood pressure. And when your blood pressures are higher, these pressures will damage the kidney, they will damage the blood vessels, you will get strokes. So people manage stress. That's why people without of stress, they just die suddenly. Someone just passed the stress.
The humble death, the silent death.
Yes. So manage stress. People manage stress. Another risk factor is cigarette smoking.
Cigarette smoking.
Yes, people who smoke cigarette, tobacco. It's really a very, very, very dangerous habit by the way to smoke. It's not good to smoke. I don't know what they enjoy in that tobacco. I don't know whether it is sweet, but it is not good to smoke. People who smoke, they have a tendency of over smoking. Even someone takes 2 packets
a day.
It's not good to smoke. You don't gain weight by smoking. You don't become beautiful by smoking. Yes.
Become beautiful by smoking.
Yeah. So smoking has no benefit. I'm telling you, please, if you are smoking, you should stop. Because you are going to die.
There are those who will tell you, because usually when you talk to them, especially it warms the lungs.
It is a very bad practice, by the way, to smoke. Because when you smoke, that tobacco, actually smoking is one of the risk factors which causes lung cancer.
It's one of the risk cancers.
Actually, every other disease is related to smoking.
And you know, that, to talk about even that, what they even put that on the, when you find the cigarette packets, all the boxes, they put that smoking will cause, and somebody
I don't know why people go on smoking when they have seen the pack, because some of the manufacturer has warned you people that smoking is really bad.
So you know that you're like,
and I don't know what's in our mind.
You are buying your disease for yourself.
Yes.
You are buying your point of death, and
smoking is really very, 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 very dangerous.
Really bad.
And another one is alcohol intake. However, for alcohol, sometimes if you drink some little alcohol, it can help you to what? Not to get some heart diseases. But over drinking also is a risk factor.
Over drinking.
So you should take alcohol in moderate. I don't know how many bottles. I will consult from my friend who is a nutritionist. But to my understanding, at least 2.
At least 2.
Yeah, 2 are enough. Don't overtake.
2 bottles a day.
But not these UGs, Uganda Walaj. They are these spirits.
Our president call them sanitizers.
But yeah, you say that people sanitize themselves every day.
For them, they just drink it.
Because now that alcohol can kill the COVID. What about the when you take it inside? So you are sanitizing your bodies. It's not good to take to overdrink alcohol. Actually, there are these ones which are over concentrated, 42%. Why should you take 42%? Take this 7%. Same of those ones which are 70%. Yes, but in moderate, don't overdrink.
Okay.
Yes.
In moderate, it all goes about taking in moderate.
Yes.
So the risk factors are similar with the causes.
Yes.
Actually, are they the same?
A risk factor, it is something which can predispose you to get that disease.
So can you go?
However, it may not all people who are obese that may get heart diseases. But or being obese, you are at a higher chance of developing heart disease. Because sometimes some people will ask you questions that, Brenda, you invited a doctor, you talked about that obesity is a cause of it. But now my father is obese, is healthy. The thing is, obesity is a risk factor. A risk factor is not necessarily the cause.
It's not necessarily
it just may be something which can predispose you to develop what? That disease. Now, like praying sex minus having a condom is a risk factor for getting HIV. But the people who play sex minus having a condom and they don't get HIV.
Okay.
Yes.
Well, that is well made clear.
Yes.
So we look at, can we now go on the causes to make it clear or to separate that?
But for the issue, for the instance of with the heart disease, we don't have a lot of causes.
Okay.
Because majority of these diseases, we don't know even the cause. Actually, just based on these risk factors.
Okay.
So maybe for valvular heart disease, for valvular heart diseases are so common. Actually, they are common. People are there. They are struggling with these diseases, and the number one cause of this valve heart disease is what we call the rheumatic heart disease.
Rheumatic?
Yes. You hear about that. My child, doctor has told me that my child is having rheumatic fever.
What is that?
Rheumatic fever, like you get people with who get throat infections. And they get infected with that bacteria known as the streptococcus. So the body will try to fight that bacteria, and if you don't take proper medication, the body at the end of the day, this bacteria will damage the what? They will damage the heart. So you get what you call the valvular heart disease.
Okay.
So rheumatic heart disease is number one cause of what? Of valvular heart disease. So another one, hypertension. We talked about that hypertension. Basically, we don't know the cause of high blood pressure.
You don't know that?
We don't know the cause of hypertension. Actually, we don't know, because the majority of the hypertension is essential hypertension. It is known. We don't know the cause. The causes are idiopathic. We don't know as doctors, but there are some causes which we know, which you can guess that maybe it is this.
Okay.
Yes. Taking a lot of salt.
Taking a lot of salt.
Yes. It can lead you to develop what? A heart disease, like
heart
maybe
disease.
Hypertension. Talked about, but majority basically it's the risk factors which predispose.
Okay.
Yes.
So basically, we look at the risk factors, and that's why you elaborated them more and you point more emphasis on them. Now, before even we enter the risk factors, we are going to talk about how you even check this heart disease in case the patient comes to the hospital.
Yes, there are so many investigations which you can do to check for this heart disease. First one, we take your blood pressure.
Okay.
We take your blood pressure. Please, our viewers, when you go to the hospital, maybe if the health workers are forgotten to take your blood pressure, you should always maybe remind them that, doctor, please, I would like to know my blood pressure. So when they take your blood pressure from the arm, they will tell you that it's normal or it's what? Because you can be with a high blood pressure and you don't know.
And you don't.
Yes, it's actually majority of the Ugandans have high blood pressure, but we don't know.
Not until you check them.
Until yes.
Oh.
Because it is asymptomatic in most of the cases.
Okay.
Yes.
So you look at that.
We look at that. With the investigation which you can do, like you can do a chest X-ray. Chest X-ray, you can look at the structure of the heart, how big it is. We look at also the lungs, if there are fluid within the lungs. Another investigation is called the echo. Echocardiogram. The echocardiogram, basically with the echo, we look at the structure of the heart. We look at the function of the heart, how it pumps blood. Look at the valves. The echo, we hear about that. Maybe they have told us to do the echo. These investigations are expensive. Another investigation is the ECG. Basically, this one will look at to help us to diagnose if there is any problem to do with the electricity within the heart.
Electricity.
Yeah, because now we're having the heart it has its own electricity.
The heart has electricity.
Yes, it has its own electricity.
Okay.
You hear about that? Have you ever seen this? What they call giving a shock? Someone is shocked.
Yeah.
Yes.
To awaken the body.
Yes.
Okay.
Yes. So the heart has its own electricity. So we use ECG to detect abnormalities which are maybe due to electrical problem within the heart. Another investigation which you can do, we can do liver functional tests. We can also do renal functional tests, because sometimes the kidney disease also causes heart diseases, and so sometimes the liver is also affected. So that's why we do liver functional tests. We do kidney functional
tests.
Tests. Yes.
Okay, so all those.
And the other tests which we can do is the tests which we do to find out if someone has had a heart attack. We do what we call we measure the cardiac enzymes, the troponins, and then and then the CRMB. So we measure those enzymes if someone we suspect that to have had a what? A heart attack.
A heart attack.
Or an ischemic heart disease. Yes.
Okay. Now, sometimes when you go in the hospital, is also this?
Yes, yeah, I've forgotten this. This is also part of, it's part of the physical exam. Doctor will use this to see, to find for mamas. Mamas, when you're having a heart disease, your blood flow within the heart become abnormal, so blood will cause a sound. So doctor will use this stethoscope to pick those abnormal sounds.
Stethoscope. Yes. It's called a
stethoscope.
And now I see a heart on drawing on it.
Yes.
Okay.
Yes.
There is a symbol of the heart.
Yes.
Okay. So basically, that doctor is telling us how they even check. Now, after all that and realizing now you have a heart disease, we go on to the treatment area. Is somebody able to recover in case they get the heart disease?
There are some. Okay, we can manage conservatively. We can manage the symptoms, although you may not get complete cure, but we can manage the symptom conservatively in some cases. Now, like for hypertension, we can control this hypertension with medication. If they don't give you medication and your BP is still within in stage 1 hypertension, the doctor can tell you to lower your BP, maybe with physical exercising regularly, and then maybe diet. So that is really one of the treatment for hypertension, because now if you restrict salt intake and taking out of fluids, your blood pressure will be dropping. Yes. So another treatment option for people with coronary artery disease, we can give them medication to help them remove this clot.
To remove the
blood clot. Yes, we can give them medication like maybe heparin. People don't need to know this but just know that if you're having a coronary artery disease, the doctor will give you medication to help you dissolve the blood clot. That's it. If you go to the hospital and as early as possible. Because now with the heart, with the coronary artery disease, if you don't go to the hospital within the first 1 hour, the heart is going to die, and when the heart muscle dies, we cannot do anything. You cannot do anything. Yes, when that area dies, we can't do anything. However, if you go as early as possible, we can remove that clot so that we can the blood supply can be restored. Yes.
So you look at that.
Yes.
Now, what after all that we appreciate, because now our time is really going so fast, but now we cannot leave it minus looking at the prevention measures. What are some of the precautions that people need to look out before they reach to that last stage of the symptoms and everything? What are some of those prevention measures that we can take?
Maybe to add on the treatment. There are some things, there are other treatment options which we do, like maybe for patients with heart failure. We can give them medication. We can also give them devices. We can put devices within the heart.
A device?
Yes, like Elovad. It helps the heart to pump blood if the heart has failed.
Can that device also fail?
But we just have to change it. Maybe if it has reached it has served its purpose. So we change and we put another one like
so
that.
Now I'm looking at the process. You change, that means the person has to be put to rest.
Yes.
Okay.
So another device, another thing which you use is a pacemaker. We hear about that. They have told us to buy a pacemaker. They are so expensive. So those are artificial things which you put to help your heart function if you are having heart failure. However, if you have done this, we have done pacemaker and these things have failed, we can do heart transplant. It's not usually done, but in other countries they do it. Heart transplant. Actually, I don't talk about that. There's someone who received a heart from a pig. I don't know.
Yeah, there was actually the news broke in on Tuesday where we saw this gentleman who had a transplant, but the talk of the day was that not any other transplant, but having a transplant of a pig. I had to, questions arose and people are wondering, what if now for that instance, what if they put that heart of the pig? Aren't there chances that you may have similar characters with like it?
No.
There are no chances at all.
For characters, it's just from the brain. It is not, it's psychological. It doesn't arise from.
It don't arise from that.
Yes.
So there is
the main function of that heart is just to pump blood. That's it.
So
but
people should not worry about.
Yeah, people should not worry because now what I think they must have looked for options and they feel they are trying to solve the problem of inadequate hearts because people with heart failures are so many. There are really so many. But you find that people who they are no, because you don't have a spare heart, you cannot give it to your friend, to your dad, to your mom. So the scientists are looking for a way how they can solve this inadequacy. So that's why we are opting to go for the animals because for them we can rear them. But it can be any, maybe it would have been a cow, would have been now a pig. That is something. It is up top of the dead and it's really big. But anyway, what maybe they considered those one for cow and they failed. That's why they had to go for the pig. But as long as it saves your life, because when they even asked the gentleman, he says that there is no way out. As long as I'm alive, I have no way out, because even if I remain with the way I am, I'm already having a weak heart that cannot sustain me. So if the doctors have a better solution, what can I do? I just have to go with the other option. So as the doctor said, we just have to have our trust in you, because you always have to take care of our lives. Now, as you are summarizing some of the prevention measures, and you for basically for the heart health, have a healthy diet. Okay. Limit your fats. Okay. Take good fats. There are some good fats. You go to the people who sell these organic foods. They sell the good food with good fats. So don't overtake fats. Another thing is to exercise. Actually, exercising. When you're exercising, you lower your risk of developing heart disease in the future. And two is manage stress. Manage stress. I know you cannot avoid the stress, but manage it. There are ways of managing stress. Take a deep breath. You can take like 5 times. It can help you to lower the stress hormones and maybe dilate the blood vessels. If you are stressed, just take a deep breath. Yes. Another way is another way how we can prevent this heart disease is really controlling or maintaining our weight, normal weight. Our weight. So yes, avoid gaining weight. If you are overweight, please go to make sure you lose weight. But those who want to gain some flesh on their body, you can gain weight, but not with fast, but with lean body. It's lean body wound. You just with the muscle. You can do a gym exercise. Gym will help you to build the muscles, not the fats. However, if you eat and sleep, the fats are going to be build up. That's what you find people with stomach like this. Okay. Well, that is Dr. Male for you. And another one is drink water. Drink water. The normal water intake for an adult supposed to be maybe 1.5 to 2 liters. That's a day. Because now 2 liters means that big Renzoli bottle, it's 1.5, then plus a small one. Those are 2 liters a day. And that is a really who does not everybody. Few people. Only a few people. Really. Because when you don't drink water, your blood vessels become stiff. And when the blood vessels are stiff, they cannot dilate. So you develop what we call hypertension. You develop what it's called hypertension. Yes. Well, that is what Dr. Malia. Any last remarks, because our time is really up? Maybe for those who want to reach me, you can reach me on my Facebook and also on my WhatsApp. My phone number is 0753 772 808. 0753 772 808. Consultation is free. Okay. Yes. Consultation is free.
Well, that is do we appreciate you having in our studio.
Thank you,
And
Brenda.
Nora is coming here in the studio to at least teach and tell the world at large, because Youth Media does not only stop here in Uganda, but you all, since you're on the social media platform, everybody
yes.
else there in the world can view us here in the studio. Hope you have learned a lot and you have picked out something very.
Next time, Brenda, sorry for interruption. Next time, I'm going to look at sickle cell.
Sickle cell.
It is common, and people. Why should you produce a sickle cell child? Nalu, in Uganda they call it nalubidi. Nalubidi. A sickle cell kills. Yeah, about people dying. They die maybe at young age. Why should you produce a child with sickle cell? Yet you can prevent it.
Well.
So tell your friend next week we are doing sickle cell. We shall be live on Facebook and YouTube. Yes, you tell your friend, share our videos, so that make sure everyone knows that the doctor is there on Thursday and Friday.
Yeah, he has told you. He's always us here. He gave us his time to be here on the studio. As he tells you, he's here. It's not like he doesn't have what to do. As you all know, doctors are very busy. It's hard to have. It's hard to have them, or it's hard to have their time. But once they come out and they say they're dedicated, because this is also some way of treatment. It's like,
by the way, we are helping people.
You're saving
we are
a
helping
lot.
people, and I don't know how the government is going to pay us, but we are helping people. Maybe. But we are helping people.
God will pay you.
But we are helping people. Okay. We are actually the main aim of this program is we are giving as much knowledge as we can to people, so that they can become familiar with these diseases.
Yeah, because now when you look at such a diseases, there are some things that can be even prevented even by the time. Now, especially in all this topic, when you say come 2030, it's going to be the world ruling cause of death all over the world. Things like this should not be missing. At least when you find the video, please watch it till the end. It's very interesting and it's also beneficial for your life. It may be your life, even a neighbor, a friend, and share the video. Don't keep it to yourself. You have been here with me, Nabshaw, Brenda, and our Dr. Male Nicholas, coming in from Mulago Hospital, who was sharing some of what you need to know about heart diseases. See you next time. You've been on Health Clinic, and Health Clinic is proudly sponsored, or it's brought to you by the Fundamental Rights and Protection, who say rights matter and that protect them for you. Don't forget to find us here on Health Clinic, always on Friday, stream live. Exactly that time is 11 a.m. in the morning. See you next time.